Hey, it's Dr. Kehres with Cade Wellness, the anabolic distributor in Michigan. I'm also a practicing chiropractor. And today we're talking about Nutra Disc. Nutra Disc is our #1 seller in all our offices, and for good reason. It's made up of Mariva, which is from the extract, turmeric is extracted down into curcumin, and Mariva is a form of curcumin. It's got a massive amount of research behind it from an anti-inflammatory standpoint, so patients respond extremely well to that. But it also has glucosamine and chondroitin in it, which most chiropractors carry in their office. On top of that, it also has proteolytic enzymes, which help with scar tissue. And so when we see patients who have any sort of injury, most likely they have a history of scar tissue. So this supplement is 3 supplements in one, and I found it is way easier to get a patient to buy 1 supplement that's in this price point as opposed to buying 3 supplements that are individual and spending $70 or $80 for that supplement. And so NutraDisc, when someone comes into the office as a patient, basically they'll sit down, and I'm always thinking about how inflamed are they, how much pain do they have, okay? And so if I'm looking at a VAS scale and this patient is at a 7, an 8, or a 9, or a 10 on the pain scale, then most likely this is the supplement that you're gonna wanna go for because it has the most impact from an anti-inflammatory standpoint. But also, if that patient has a history of any sort of disc issues, if they have a history of arthritis for the glucosamine chondroitin, if they have a history of any serious strains or sprains, then the proteolytic enzymes that are found in this as well are gonna be a benefit. And so most patients that take this, they do see some good results, and it's a huge asset to them. You know, chiropractic is gonna get them moving better. It's also gonna reduce their pain, and then looking at the supplement is gonna help as well. So I always tell them, when they come in, you know, through adjustments and the chiropractic and the stretching, we can get your pain level down, you know, at least a few notches, hopefully a lot of notches down on the VAS scale. But if they also implement the anti-inflammatory found in NutraDisc, in the proteolytic enzymes and the glucosamine, they can also do very well. So if someone comes in and they're very acute, I'm gonna have them take pretty much 4 to 6 of these NutraDisc per day. They can take it on an empty stomach, and it's gonna have the most impact because the proteolytic enzymes are going to absorb better on an empty stomach. If someone is coming in and their pain level's not that high, it's a 3 or a 4, but they have a history of a lot of arthritic type issues, they have a history of disc issues, they have different aches and pains, then NutraDisc is still a very, very good option for them because it gets these 3 supplements in one, and the compliance is much, much easier. So that's why it's the #1 seller in our office.